Good afternoon, everyone. We'd like to thank you for being here today. I'm Patty Christ, and I currently live in Hudson, Pasco County, and I'm a mother of four, 3 adult neurotypical children, and 1 5-year-old son who is on the autism spectrum. My fellow colleagues are Anayre Mitchell from Avalon, Orange County, Jennifer Gray from Fort Lauderdale, Broward County, Corina Buscemi from Winter Park, Orange County, Geraldine Callaghan from Kissimmee, Osceola County, and Heather Cedeno from Sorrento, Lake County. We are all parents and advocates with the Florida Developmental Disabilities Council's Partner in Policymaking Class of 2016. We're here today to talk about the lack of medical coverage for individuals with disabilities. The Developmental Disabilities Assistance and Bill of Rights Act of 2000 defines a developmental disability as a severe chronic disability of an individual that is attributable to a mental or physical impairment or a combination of mental and physical impairment. Is manifested before the individual attains the age of 22, is likely to continue indefinitely, results in substantial functional limitations in 3 or more of the following areas of major life activity: self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living, economic self-sufficiency, and reflects the individual's need for a combination and sequence of special, interdisciplinary, or generic services, individualized supports, or other forms of assistance that are a lifelong or extended duration and are individually planned and coordinated. I will now turn it over to Anna, who is going to cover some of the statistics, and I'd like to thank you.
Hi, good afternoon. I'm a nurse and a physical therapist, and I'm a proud citizen of this country. I also have to have a beautiful, mischievous 5-year-old that happens to have autism. Do we know that according to the 2014 census, only in Florida, almost 3 million of people are uninsured. 10% of the people have a disability. For qualifying for Medicaid, the maximum gross amount, it means before every deduction is taken from your check, for a family of 3 is $26,813. In Orlando, for giving an example, the cost of housing for a 900 square feet apartment is $1,100 a month. That amount is almost half of the maximum income you have to qualify for Medicaid. That's not counting food. People have to eat, right? It's not counting clothing. It's not counting electricity, phone, and it's not counting the cost of living with a disability. A lot of families don't qualify for Medicaid because their income is higher than they request for qualifying. They make you carry for a really, really expensive support that our kids and our members with disabilities need to be productive and to have a quality of life.
My name's Jennifer Gray, and like they said, I'm from Fort Lauderdale in Broward County, and I have 2 young kids, ages 3 and 4, both boys, very talented, active little boys that are both on the autism spectrum. In 40% of families with a child who has special health care needs, a member of the family stops working to become a full-time caregiver, according to the study by the Centers for Disease Control and Prevention. The total costs per year in 2011 for children with autism in the U.S. were estimated between $11.5 billion and $60.9 billion. This significant economic burden represents a variety of direct and indirect costs, from medical care to special education to lost parental productivity. Among children 0 to 4 years old with private insurance, average medical care costs were 12 times higher for children with Down syndrome compared to children with the same age without Down syndrome. The CDC also estimated in 2003 that the lifetime cost of care for an individual with cerebral palsy is nearly $1 million. For patients without health insurance or therapies not covered by commercial insurance, Therapies such as speech, occupational therapy, and physical therapies can cost anywhere from $200 to $250 for the initial evaluation and from $50 to $130 for every half an hour session. The frequency of the sessions can vary, but they're typically multiple times a week. ABA therapy can also take place at the home using therapists in training or undergrads that have taken workshop in the ABA program. This might be expensive, typically ranging from $5,000 to $20,000 a year.
Hello, my name is Corina Buscemi. I'm a mother of a 13-year-old son who is intelligent, funny, and has a great attention to detail. He also has autism and other disabilities. I'm presenting some of the obstacles with insurance companies. This is by far not all the obstacles that all of us face. Refusal to cover interventions that are provided by a certain professional. Plans reject a certain kind of intervention as experimental or not evidence-based, despite evidence stating otherwise. Refusal to cover an intervention because plan believes it is education service and not health service. A plan covers but not at the level that the person needs. And plan covers but not enough providers are in the network, my personal favorite. State mandates vary greatly, leaving many families uncovered or not receiving all benefits, leaving some with better outcomes than others, which is very unfair. Families are spending up to $1,000 a week or more on therapy. A lot of that is out of pocket under the insurance because it's leaving families broke and not able to receive much needed therapy. Too many barriers for coverage for children and adults for the interventions that are needed. They lack support and resources. And a lot of state health plans, they misinterpret the laws and they just recognize one therapy, leaving many people confused and not well informed. If changes are not made, people with disabilities will not receive the therapies and interventions that they will need to lead productive, meaningful, and successful lives. Thank you.
My name is Geraldine Callaghan and I'm from Kissimmee, Osceola County. I come before you as a mother to a wonderful, compassionate, kind, loving, humorous boy who enjoys playing hide and seek with his mom and dad. Swimming, taking long baths, biking with his friends, and telling funny secrets and jokes. Who loves to surprise and be surprised, and who dreams of becoming the next ninja warrior. Thanks to language therapy services he received and is currently receiving, he has blossomed and is now a very far cry from where he was many years ago, when he did not respond to his name, when he didn't start to talk until he was 5 years old, and when he did not care to play with other kids. When you see him today, you would never know at first glance that at the age of 2.5 years old, he was given all sorts of labels by his doctors: language impairment, developmental delay, and later on, autism. Early Steps, the state's early intervention program, provided language therapy for my child till the age of 3. Before he aged out of Early Steps, my husband and I had done our research to find the health insurance plan that would cover our child's language therapy services. So we switched our commercial health insurance plan from United Healthcare, who did cover language therapy, to Blue Cross Blue Shield, who did cover it. When it came time to get the language therapy services, we were disappointed to learn from Blue Cross Blue Shield that all the labels given to our child, his doctors gave him when he was 2, were considered to be in the category of mental and psychosocial conditions. And unfortunately, anything mental or psychosocial was not covered at all. From paying premiums to United Healthcare and Blue Cross Blue Shield, ranging from $175 to $250 every month in the last 9 years of my child's life, and an average total of $27,000 paid to these two health insurance companies. This huge amount of money, still, none of them covered my son's language therapy services. I reached out to apply for Florida's Kid Care. Florida Kid Care is the state of Florida's health insurance program that covers children ages 0 to 18. The program is made up of several plans which cover speech and language therapy services for children. Numerous and unfortunate times, the Florida Kid Care representatives have told me we can't and we won't qualify because our household just made too much money. We saw the writing on the wall that said, in order for us to get a health insurance plan that would cover our child's needs for language therapy, my husband and I, we had to earn less. The only option we have taken then for our son to receive his much needed language therapy is by paying out of pocket. Since my son turned 3 and no insurance would cover his language therapy, we have paid $3,360 a year and over $20,000 for the last 6 years for his speech and language therapy services out of our own pockets. I can tell you this, the struggle to find and provide services for this child to overcome the challenges related to his disability is real and financially draining. We accept the responsibility of taking care of our child's needs, but we are caught in the problem of choosing to pay more on top of what we are already paying for our health insurance premiums in order to get the services our child needs versus choosing to work less and reduce our hours in order to qualify for Florida Kid Care. We are your typical American middle-class family, hardworking, self-reliant, and self-sufficient. But the current system is not helping us maintain these values. Our household has been pushed to the edge, making it harder for us to juggle between keeping a roof above our heads to paying for our son's therapy needs and my husband and I preparing for our old age and future retirement. The system presents us with barriers that are bankrupting us and missing golden opportunities for our child. This is the complicated life my family has to live through. It is not the American dream. My husband and I envisioned better, and I think our legislators can make it better by making these insurance companies provide the needed language therapy services that our son needs. We are not asking for a handout. We are asking for what we believe we have already paid for. And we would like to see a win-win situation where our child wins, the parents win, the state wins, the system wins. Thank you for your listening ear.
Good afternoon. I'm Heather Cedeno. I'm from Sorrento, Florida, and share with you my family. We are a dual income household. We are a dual college educated household who has, we have college loans that we had previously to starting our family. My husband is a U.S. veteran. He is also a U.S. disabled veteran. He has direct service-related injuries, who fought for this country, and willing to sign a blank check, including his life. He has dedicated his life to the protection and service of others, as have I, in the fact that I work currently for one of the largest healthcare organizations in the state of Florida. I work for a pediatric hospital in a pediatric capacity, fighting for their rights, fighting for the services, coordinating the care for our children, all children, regardless of their abilities, disabilities, or functionalities. I do this with great pride every day. I have a 3-child household. I have 3 beautiful children who are fun-loving and individual personalities, each one of them, even though they come from the same home. My oldest child also has a laundry list of diagnoses. Primary diagnosis would be autism spectrum disorder. According to current legislation and policy, my health care coverage through my employer is allowed to and does exclude autism services out of their coverage. Due to the fact that my child is given a diagnosis of autism, he does not qualify for the services that he needs in order to grow and live comfortably and reach his full potential. Also, due to the same legislation that we are currently under, my household makes too much money. So therefore, we do not qualify for Medicaid waiver or otherwise at the current moment. We are stuck in a lose-lose situation. We either leave the workforce and lessen our household income, or we provide services so we can provide services for our child, or we remain in the workforce and our child loses out. What we are asking is not to be a burden on the system. We don't want that. We don't want our child to be strictly on the system. We would like to continue to work. We would like to continue to pay our taxes. We take pride in paying our taxes. We are asking that legislation be changed so that families and individuals with disabilities would also qualify regardless of your household income. If you carry diagnoses that would count you as a disability under the Developmental Disability Act, you would automatically qualify for Medicaid services as a secondary insurance. This would not be the primary, this would be a secondary. This would supplement those services that are not covered or have such high copays that it is crippling our families. It's making our families choose between a roof over our head or other children having a life, going to the movies, having friends, having sleepovers, or having our children with our special needs have services and a meaningful life. It would be win-win in the fact that we are still able to pay our taxes. We're still paying into this system. We want to do this. We want to be able to work. We want to be able to raise our children to be able to work and pay into the system by the fact that they're able to gainfully be employed. But we also want the services. We desperately need these services for our children to reach their full potential. We are asking to share the burden between individuals and the state. Thank you.